What's going on, everybody? We're back to you for another edition to Chamber Chat. As we have the motto, we're keeping it rolling. And we're joined today by Nancy and Daniel Gunn and Nancy with AFC Urgent Care over on Brandon Ave. We'll call it on the other side of the, on the side where Kroger is of the Tower Shopping
the lower
Center.
level.
So on the lower level, yeah, exactly right. So Nancy, Daniel, good morning. Great to see you both.
Morning,
and
Eric.
we'll look forward to seeing you in person soon. Daniel, why don't you give us this update on how everybody's been doing? I know obviously from your guys' side, just unbelievable adjustments that have had to occur and will continue to occur over the next time frame. But hope everybody in the family, as well as families of the staff and all the staff have been healthy and safe. And give everybody an aspect on how you guys have really had to adjust.
So thanks again for having us, Eric, and hope everybody out there staying safe in these mad times, as you can call them. But so we've pretty much been adjusting on the fly as more and more information has come out during the COVID pandemic, because nobody seems to really know exactly what's going on with everything. So we initially locked our doors. We obviously kept the business open, but we had our doors locked and would have the patients come up and call us and take a kind of a pre-screening survey just to make sure that they weren't showing any of the symptoms, and we had face masks for them. And we also adjusted our hours. We initially, when it started, closed off at 5, which we normally go to 8, and we've slowly been pushing back as the numbers have come back up. But it's been interesting from a business standpoint of having to adjust to something like this. But we've got such a great staff and such a great manager here that it's been a pretty seamless transition for us. And
yeah, no, obviously glad to hear everybody's been safe, and certainly I think through this whole thing we learned early on, and even now that so many things are changing, maybe not on an hourly basis like they were, but maybe more on the day and the week basis by this point. So glad to hear kind of. We've overused the word pivot, but I think in your case, it might be the best term because of just the aspects of how, how you're serving the community and serving the region. So Nancy, as the center administrator, when it comes to, TeleMed and now the antibody testing, certainly a lot of things go into both of those aspects. So why don't you dive into a little bit on the TeleMed focus, and now with the antibody testing is kind of the next step and the next level to continuing to, help the region and of course, help the country and the world improve, but more focused here in the Roanoke area.
Absolutely. And for us, especially with locking the doors, it's more about keeping our patients and our staff safe. So for us, we don't want to neglect our patients that may be experiencing COVID symptoms, but it's certainly something we want to make sure we go the right way about seeing those patients. So if we understand that they're having symptoms, we certainly want them to return to their car, and we can set up a telemedicine visit where they call in. We get them registered, and then we get our nursing staff to triage over the phone. And then they sit down with the provider and do a face-to-face, essentially over an iPad app or telephone FaceTime. And so for the most part, it's been pretty seamless. Most people are accustomed enough with technology to be able to do it. We've had a few people that obviously the older generation, it's a little difficult. So we have accommodated that by doing telephone calls, which does make it a little bit more difficult to diagnose. There's certainly most of our patients, we can do the average day-to-day cold symptoms, sinus symptoms, back pain for the most part by phone. There's a few patients that upon getting into that phone call, we do realize we're going to need to do a little bit more diagnostic, but we can at least rule out any concerns of contact and have them come in at that point. There's several patients too that just aren't comfortable coming into the office right now. It makes them very nervous. So for them, having telemed as an option has been fantastic. Simple refill medications for them that's the perfect way for them to be able to do it. In addition to that, we've had a lot of patients that have said for them, they think that the telemed is faster and more seamless and they prefer it. So it's definitely something we'll probably be carrying through as we transition out of pandemic time, just to make things better for our patients, especially during flu season where volume's so high. If you're here for something simple, you don't want to sit in the waiting room with a bunch of sick people.
Yeah, no, it's interesting, kind of an interesting aspect of how that added level of medicine, now is going to really become a staple. And how, again, you guys are figuring out best procedures and best way to handle this. moving forward on what's working, what's not, especially when it comes to, you know, the different, we'll call it the different age groups and how they interact with technology.
Absolutely.
So, and did you want to mention anything on the antibody testing and how that's maybe tied into all this as well?
Yes, so with COVID, we have started doing the antibody testing in addition to the drive-through testing that Carillion offers. We do all of those visits by phone. A few people have come in and we send them on to the drive-through testing. Now, if there's some patients that feel like they've been exposed and just want to do the antibody titer, we have them come in for a visit. We discuss a little bit about their concerns as to why they may think that they've had encounters. And then we just get them set up for a blood draw. And it usually takes about 4 days to get those results back. And so far, we actually haven't seen a high number of people with antibodies. So it sounds like we've done a really good job of containing it in the area so far.
Yeah, absolutely. And I'm obviously glad to hear that. And I think we've seen, you know, as compared to other parts of the state, thankfully the Roanoke Valley and the Roanoke region, other than some isolated challenges, we've been blessed, I think for sure. And I think that's a testament to the region and the community and to Carillion and Lewis Gale on how they were able to help contain challenges that they may have encountered. So I'm glad to hear that. So for folks to learn more about you all, I mean, of course, you know, we're talking kind of the with you as far as chamber chat, as far as how this is affecting you in the COVID world. But you know, we'll get past that. And you know, there's so many services you have to offer. So how can folks learn more, you know, to take advantage of the services that you offer?
They can go to our website. It's afcurgentcare.com/Roanoke, and we have a list of all of our services, what we have to offer, and things like that, from our just basic office visits to a wide range of occupational health, so like drug testing, pre-employment physicals, DOT testing, things of that nature. And you can also, if you can't get online, you can call us at 540-774-0000, and anybody on our staff would be happy to help you in any way.
And people here certainly think that we're more of a sick visit scenario and you only come to the doctor when you're sick, but we certainly offer pre-employment physicals, school physicals. We've now set up some PCP care. So if you're looking for a PCP, we can certainly set you up with one of our providers. So there's definitely things to look at, even when you're not sick, that we can get you taken care of.
Sure. Yeah, and I love that, and variety of services, and that's certainly an important point to hit on. So we appreciate you both joining us for Chamber Chat this morning, and you know, so glad to hear everybody continues to be healthy and safe, and all the ways that you're adjusting to continue to serve the region. So remember, AFC Urgent Care on the Kroger side of Towers, lower level. It's probably the best way to explain it. Technically a Brandon Ave address. AFCurgentcare.com/Roanoke to learn more. Thanks you both for joining us. That wraps up another edition of Chamber Chat. We're keeping it rolling. We're just going to continue to use that every day. We'll talk to you soon.